Right now, we're seeing a lot of COVID and flu. And for most people, these illnesses are very uncomfortable but manageable at home. I don't want you to panic, but I do want you to take symptoms seriously and know when you need to ask me for help. Most healthy people will start to feel sick quickly. They'll feel fever, body aches, cough, sore throat, and fatigue. The first 3 to 5 days are usually the hardest. Rest, fluids, fever control, and staying home matter more than just trying to push through, especially at work. What worries me is not the high fever alone or feeling miserable for a few days. What worries me is when the illness changes directions or the body seems to be really struggling. Please call me. If your fever is not improving for after 3 days or it keeps returning. If you feel worse instead of slowly getting better. If you have shortness of breath, chest tightness, or wheezing. If you cannot keep fluids down. If you feel unusually weak, confused, or lightheaded. If your child is very lethargic or not acting like themselves or not drinking. Go to the ER immediately if you're having trouble breathing or gasping for air, your lips or face look blue or gray, you have persistent chest pain or pressure, you can't wake somebody or they're hard to arouse. If your child has fast breathing, retractions, or is not responsive. Retractions are when they're sucking in really hard and their stomach looks like it's going towards their ribs. So that's retractions in kids. You feel like something is seriously wrong and you're scared. Trust your instincts. What you can do at home, number 1 is rest. This is not the time to power through. Drink fluids regularly, even if your appetite is low. Use fever reducers like Tylenol or ibuprofen. Do not alternate. A lot of people tell you to do that, but research shows that it doesn't help. One or the other so it doesn't get confusing. Isolate while contagious to protect others, especially the very young and the very old. Check in daily with how symptoms are trending. We have unfortunately seen a few cases recently, especially in a couple of young people in our county, that were very severe. These are rare, but they remind us why listening to our bodies and asking for help really matters. You're not alone. If you're unsure of what to do, please call me. My job is to help you decide what's safe to manage at home and when you need more care. So at our clinic, you can call our clinic and it tells you to call DeKalb Regional Medical Center. Their switchboard will put you right into my cell phone. Please don't hesitate. You aren't bothering me. All right. And what a lot of people ask is, am I contagious? We can't tell exactly when you're contagious and when you're not. Most of the time you are contagious if you're having symptoms and you have fever, but fever alone is not the only reason for being contagious. If you're coughing a good bit, have a lot of runny nose and a lot of symptoms, then you probably are contagious. People can be contagious before they feel sick and sometimes after they start feeling better. A negative test does not always mean someone is not contagious, especially early or late in the illness. And sometimes test results show up as negative and it can be positive a day or so later. So if you have active symptoms, frequent coughing or sneezing, avoid close contact with others. Early days of the illness, 3 to 5 days for flu and COVID, you're at the highest risk. So symptoms are clearly improving and getting a lot better, then you're probably likely way less contagious. And so if you feel sick, act like you could be contagious. Masks can help, but it does not keep other people from getting what you have or you getting what they have. So wash your hands frequently and don't drink after each other. So call if you have any questions. Thanks. I hope this is helpful. We want everybody who gets sick to get well and to stay well. Thank you.